Good evening, everyone. Just tuning in. Um, Tonight, we're going to be continuing our series on women's health. Tonight, we're going to be discussing fibroids, uterine fibroids, ovarian cysts, endometriosis, and PCOS, which is polycystic ovarian um, syndrome. So, back a few days ago in part one, we talked about the endocrine system. We talked about the pituitary gland as being the master regulator gland and how it controls the entire endocrine system as a whole. We also talked about how our glands secrete hormones. And things of that nature, and how our ovaries actually produce estrogen. Now, tonight we want to kind of continue on that because in the first lesson we talked about yeast infections, we talked about bacterial vaginosis, which are all treatable with herbs. As well as trichomonas, and as always, I always suggest that you go see a medical professional for a diagnosis. It's not always wise to treat yourself, even if you do have symptoms. It's always a wise thing to go to a doctor just to get the prognosis by them, because they do have tests that can test you for different ailments. And we talked about in the first part one, we talked about, pH balance. And when your pH is off balance, your body gives you indicators or symptoms. And the, top two factors that we talked about was like a foul odor or unusual discharge. So and we said, pH deals with the measure of alkalinity. And if your a normal range for a healthy vagina is 3.5 to a 4.5, which is more on the acidic side, but that range will help keep you healthy and protect you from infection. So tonight we're going to, talk a little bit more about the endocrine system. We're going to focus, like I said, on the fibroids, the ovarian cysts, endometriosis, as well as PCOS. About 200,000 women lose their uterus on an annual basis every year, and it's due to complications and growths within. Some of those women, could have done alternative methods, but when you have things that rupture or those growths get too big, the only remedy at that time is to do surgical procedures. So the three main causes of all of these conditions that we're going to be talking about tonight is estrogen dominance. And what that is when the ovaries produce too much estrogen. And we're going to focus on how these conditions are formed and how to treat them. So I just want to say hello and thank you for everyone that's tuning in here with me tonight. So the first topic tonight, we're going to talk about uterine fibroids. Basically, we have two hormones that are produced in our ovary, and it's estrogen and progesterone. And they basically stimulate the development of the uterine lining during each menstrual cycle in preparation for fertility, pregnancy. Now, if we get too much of those two particular hormones, the estrogen and the progesterone, it causes fibroid growth. Now, typically, if the fibroids are measuring around no greater than 5 to 7 centimeters, you can actually treat those on your own. If the fibroids are 8 centimeters or larger, the only remedy at that point would be to surgically have them removed. And sometimes they're so big that they actually have to take the entire, uterus out. And that would, cause other troubles later on down the line. The second one that we're going to be focusing on are the ovarian cysts. Now, ovarian cysts are little sacs that are attached to the ovary, and they're filled with fluid. Typically, you don't get symptoms with ovarian cysts, and some of them, are very small, and they have little to no discomfort. However, if they're left there over time, long time, they can become cancerous, just so you know. But if they're benign and you leave them there over time, they do have the potential to rupture. And the reason that happens is because they can get filled with bacteria, they can get filled with pus, and then they create an abscess. And once that abscess ruptures, it causes all types of issues. Because it's bacteria going into the bloodstream, and it causes you to get very ill, causes a lot of pain, and can also lead to, you having to get surgery as well. Now, the next one is endometriosis. And that's when the tissues that make up the uterine lining, which is like the lining of the womb, it grows outside of the uterus. So that lining is supposed to be produced inside the uterus, but this particular condition is where the lining grows on the outside, and that causes a lot of pain. I mean, extreme pain. Even like with your periods, the monthly cycle is not supposed to hurt, but with this particular condition, it's extremely heavy blood flow. And the same thing with fibroids, they do produce heavy blood flow as well. And with endometriosis, it also has, can lead to painful sexual intercourse, and it can also lead to infertility. And then the last one is PCOS, which is PCOS, polycystic ovary syndrome. And that condition affects the actual hormone levels in the body. I had, someone I was speaking with, a little earlier asking about, the hair. They were shedding their hair, and they just, couldn't figure out what was happening. They purchased all these hair products. When your hormone levels are off and you have been diagnosed with PCOS, it's basically your body is producing higher than normal amounts of male hormones. And with that, those male hormones are called androgens. This causes an imbalance in the body. So you're skipping periods, and it also leads to infertility. And also, it can cause your hair to shed. It can cause facial hair to grow as well. So these 4 conditions we're gonna, kind of hit tonight on, how we can, treat them and how we can, deal with them. But moving back to part 1, when we started discussing the other night, the endocrine system. Now, all of your glands depend on your intestines as well as your liver. Those are your detoxifiers, waste removers within your body. So your endocrine system works heavily with your digestive system. Now, the only way to promote balance within the endocrine system as well as the liver and the digestive system is just to make sure that you are eating the right foods and doing the right things to make sure your liver is healthy. And the liver is it plays a humongous role when it comes to treating the fibroids, the cysts, the endometriosis, and the PCOS. If your liver is not healthy, if your liver is not filtering out the toxins from the body like it's supposed to, all of these 4 conditions will, form as a result of that. So the main focus is to make sure that the liver is healthy so that it can remove the toxins, remove the excess, estrogen and hormones that need to be pushed into the intestines, which is, going to, cause it to be removed as, excrement. Now, your liver has over 500 functions. Now, the ovaries produce a hormone called estrone, and that's estrone, which is a type of estrogen. Now, the liver breaks down this estrogen for you. Now, if the liver can't break it down, the hormone is actually refiltered back up, it tries to filter it out and pushes it down into the intestines. So if it can't break it down, it'll go backwards, and it refilters itself to go in the opposite direction. And it eventually instead of being removed by, through the bowels, it travels right back into the uterus. And that's how you get an excess amount of estrogen. And that estrogen creates, the fibroids. That excess creates the ovarian cyst, the endometriosis, as well as the PCOS. So these growths that, can take place in your uterus depend on that estrogen. So if you can get the estrogen in balance, it will get it balanced and get it in check. This will cut off the supplier to those fibroids and to those cysts. Now, if you hit menopause and you go to a doctor and they're checking the size of those fibroids that you may have had, they'll tell you that they're shrinking. And the reason being is that once you go in menopause, your body begins to produce less estrogen, as it should. So to keep the liver in a healthy state so that it can break down the estrone, you've got to rebalance the liver and the intestines so that it can in turn help your endocrine system work properly. So your body is literally like a humongous computer, and each part has its own intricate role. And most people, may not have, most doctors won't even tell you that the endocrine system, plays a role with you developing these types of conditions in the womb. Now, your pituitary gland, that's the master regulator. It regulates everything in the body and the endocrine system. It depends on the hypothalamus, and that's going to be located more so in the chest area, near your adrenals, and not too far from your thyroid. Now, the hypothalamus plays a role with the reproductive system. It sends signals to the pituitary gland to regulate, our monthly cycle, to regulate the overall health of our, ovaries and womb as a whole. Now, if though the signals get delayed or become imbalanced, it creates an issue with your prolactin. That also creates an issue with your progesterone and estrogen, which also can lead to infertility. So everything that that will create an imbalance within your womb can lead to infertility and issues with your menstrual cycle not being regular, because you should have a menstrual cycle. If you're within that certain age range, you should have one every month. Even eating estrogen-rich foods can cause an imbalance within the body as well. So if you're having issues within the womb, and then you're also eating these estrogen foods and your liver is not breaking down the estrone like it should, you have all this excess estrogen in your body, and it's going to cause trouble within the uterus, trouble within the ovaries, your sex hormones. It can even decrease your sex drive as well. So if the pituitary gland is not normalized, if it's not balanced, the ovaries are going to continue to produce those male hormones, which, like I said earlier, can lead to the hair loss. It can lead to, PCOS, the facial hair forming, weight gain, and things of that nature. So you have to make sure that you are using the foods that's necessary within that rainbow diet to fix those areas in your body. Now, we're not going to be here too much longer, because this is going to be a very short lesson tonight, just to kind of go over everything for you. But we're going to focus more so now on what we can do to repair these situations. And if you have any questions, you can drop them in the chat down there, and I'll look at them if I catch them. So the first step tonight, we're going to focus on the types of foods, like I was just saying, the estrogen-rich foods. Okay. And there's different types of estrogen-rich foods, and I got a few examples on here for you. So avoiding eggs, cheese, flax seeds, dried fruits, sesame seeds, a lot of garlic, wheat bran, soy, the soybeans, tofu, anything that mimics estrogen or has the properties of rich estrogen, those are the foods that you definitely need to avoid and stay away from. The second issue, or the second way to treat this, is staying away from synthetic hormones. A lot of times we will use plastic bottles and bowls to store our foods, to store our waters. We drink from, we'll go to a local store and buy water in those plastic bottles. A lot of the bottles, a lot of the companies are now using BPA-free bottles because they know it's a toxin that's in the plastic. And those are synthetic hormones. And when you're eating those foods or drinking that water, you're ingesting these synthetic hormones, and that can also affect you in the long run when it comes to your uterine health and making sure that you have a healthy womb. And now that plastics, and a lot of times when you put hot foods, I've seen people use plastic bowls and microwaves. Once you put those hot foods in those plastic bowls, it causes the xenohormone that's in that plastic to absorb faster into your food, and then you're ingesting that. Now, there are herbs that we use, and we do have a blend for this. It's just not up on my website yet, but these are the herbs that you would use to treat these 4 conditions. The first one is the chaste tree. Now, that normalizes your estrogen. It helps the growths to stop. So that's like our main herb that we use. That and dong quai, those 2 herbs are our main herbs, and they do all the work. However, all the other herbs are supporting herbs that help to make sure that the chaste tree and the dong quai can do what they're supposed to do. Now, the dong quai helps the liver to remove excess estrogen as well as moving the blood. Now, the red raspberry leaf is very awesome when it comes to tonifying the uterus and strengthening the uterus. It also aids women when they're getting pregnant, because it can prevent miscarriages. So it strengthens the uterus, and if it's taken at the end of your pregnancy, it also aids in like a quicker birth. So that red raspberry leaf is really good for tonifying and strengthening the womb as a whole, the uterus. Then we have saw palmetto. That one actually helps to build your immune system. It stops the growths from getting bigger, so it'll cut off the food supply that the fibroids and the ovarian cyst need to grow. So the saw palmetto cuts that off, and it aids like with pelvic pain also. So if you're having pelvic pain, the saw palmetto helps with that. We have the shepherd's purse, and that's good for heavy flow, a heavy bleeding. The dandelion root is good for moving the waste out of the bottom. Yes, Romania, it helps to build the blood through the spleen. We have cypress root, and it aids with the reproductive system as far as growths within the uterus. We have the peony root. The cinnamon deals with the inflammation. Red clover deals with growths. Red clover and pau d'arco are your shrinking plants. Those are the 2 that are going to help to shrink the fibroids and cause them to decrease in size. And then you have your cleavers, the blue violet leaves, and the buckthorn bark. Those 3 help with the lymphatic system. So in order to get this excess estrogen out of your body, we have to have herbs that help remove and drain the toxins and help prevent constipation. So the buckthorn bark is good for constipation, as well as helping the bile to move through the system as a whole. Okay, so I saw a question about garlic being one of the estrogen-rich foods. Too much garlic, it can, cause issues, but garlic is good overall to eat because it does help. But I put it there because sometimes we can overdo it with the garlic, so we want to eat it, minimally. and not eat it in excess. What was the other question? I saw another question come through here. I just can't find it now. I don't know where it went. Okay, so the supplements that we would take with this is going to be your vitamin C, of course, to boost that immune system, and make sure it has the bioflavonoids. B6, 300 milligrams would do. The B complex vitamin, the super B complex, that's really, really good because it does help with the glands and the endocrine system as a whole. And, about 15 milligrams would do. Vitamin E and vitamin A, those both are really good to aid you along with the herbs. So the herbs, the rainbow diet, and these supplements are going to help you long term. And then progesterone cream. You would use that once a day, but only a short term for 21 days. And you would alternate the locations that you're going to use this. So every 3 days, you would start with your breasts. Then on that, after 3 days of using it there, you would go to use it on the navel. After 3 days there, you would go to the thigh. And then, of course, after that set is over, then you'd go back to the breast and repeat the process until the 21 days are over. We would use the evening primrose oil, 1,300 milligrams per day. That would, take care of inflammation. Then the DLPA, which is another supplement, it's an amino acid supplement that aids you, for pain, and you would take that a week before your menstrual cycle comes on. And Melody, to answer your question, can a fairly healthy female take these herbs as a precaution? I do have another blend for, it's the Healthy Womb blend. And it's not as extensive as this with all these herbs in it, because this blend is specifically for treating those 4 conditions. So I wouldn't recommend this one for, someone who doesn't have them, because we do have a blend available that's just for overall uterine health. And that is our Healthy Women's blend, or Healthy Womb, I'm sorry. Are there any other questions that anyone may have for me? Hi, Robert. Hi, Mary, Marissa, Suzetta. Okay, so just trying to get this phone back on this stand. Okay, so that pretty much, is what we're gonna is the end of my lesson tonight on women's health. The next lesson that I plan to cover is yoni steaming. I've gotten a lot of questions because I do have a yoni steam available on the website, and a lot of women have asked about yoni steaming. So I'm gonna devote a lesson to teaching what yoni steaming is. And how to use it, the benefits of it. I've had several people who have used the steams and have had great success with it. And I've even had women, basically tell me that they had the fibroids, and the fibroids were actually coming out, as a result after using the steam, because steam is, something that we use to clean things. And it's here in the Western area that we just don't hear a lot about it, but it's used quite a bit in, South America, over in China, over even in Africa. Even in the islands, a lot of people do their ancestral, duty of steaming. So I'm going to focus a little bit more on that tomorrow. And I saw a question. Depending on the person's age, Cynthia, these herbs will work as well as a diet change. And also, let me say this. If you go to Patrick's page, christybooks.biz, there is a program guide that will guide you along the way with eating the right foods, what foods you really need to take, that can guide you in the right path. So as far as a teenager, this program would be safe, but I would be mindful with the progesterone cream and using that, especially depending on their age. So, we can talk about that as well. But a little later if you want to. If you can DM me, and we can focus on that for you. Yes, we steam after giving birth. I did a steam. My son is 2 years old. I did what they call a Haitian postpartum detox bath, and it was I used the bath, and then I also used the steam, also the yoni steam afterwards. So those are two great ways after giving birth to a baby to help the uterus heal and to help tonify the uterus as well. So steaming is, like I said, a really good way to help promote a healthy uterus. Victoria, I showed, and you can see it on the replay. I listed all of the herbs and the supplements that you would use. So once the replay goes up, you'll have access to, fast forward to that portion of the video and just get them copied, because I left it up for a while so that you could see it. So, but yeah, so tomorrow, around this same time, I'm gonna get it all set up for the yoni steaming. And I was supposed to have the gentleman that was going to create one of my actual sauna to show you guys an example of what you can do at home and how you can use it at home as well. So I don't think there's any other questions. So I'd like to thank all of you, for joining. And I also want to thank you all for supporting, Holistic Harmony Herbs. That is my new baby. I am, birthing this business out, trying to, do as much as I can to help ladies, to help men, help women, children, along the way with whatever, way that I can. If you have additional questions or things that you want to discuss in private, I'm, available for that as well. You can DM me. Sometimes my DM is really full, so it may take me some time to respond back to you. So it's not that I'm ignoring you, but I do try to get back to everyone that does ask me a question. So if there's nothing else, so Nicole, as far as the yoni steaming, I'm going to go into details on that tomorrow. And go over the purposes of it, the uses of it, and the different herbs that you could use in them. Like I said, I do have one available on the website, but the one that is actually going to treat the conditions that we talked about tonight is not on the website. So I'll focus a little bit more on that tomorrow once I actually explain what yoni steaming is. And again, I want to thank everybody that has purchased, something from my company, that has supported me. I appreciate you. And if nothing else, no other questions, I'd like to say good night, and I hope you guys sleep well.